Dr. Jesse, good morning. I'm looking at this organizational chart of the VA. I guess it's the Veterans Health Administration. And I'm wondering if a physician within the VA wants to lodge a complaint or make a suggestion, where on this chart does that occur? I mean, I don't see a place really that has physicians.
So there are two places, actually. On that chart, there is Dr. Madhu Agrawal, who is the Deputy Undersecretary for Policy and Programs, and in that is Patient Care Services. And rolled up under Patient Care Services are much of the physician-based and other clinical services. So,
well, I guess the reason I'm bringing this up is that I worked at the VA and I talked to many VA physicians, and they complain that they have very little recourse when they have suggestions for changes or complaints within the system. I notice here on the chart here that the Office of Nursing is right here under the reports directly to the Principal Deputy Undersecretary.
Yes, sir.
So why isn't there a similar place for doctors?
Well, so the physicians work through programs. So the Office of Surgery.
What I'm trying to get to is that it seems like the nurses have more input to leadership than the doctors do, and the doctors often have suggestions that improve the quality of patient care. And the physicians I talk to, I just talked to a group of VA physicians yesterday, and they're frankly telling me that they get reprimanded. And there's retribution if they try to change the system. And have you ever heard about that? I mean, I've had VA physicians tell me that they were not allowed to talk to me by their superiors. They're told not to speak to me.
So let me,
Is it the policy of the VA to not allow physicians to speak to members of Congress?
Absolutely not. Absolutely.
Well, I'm glad to hear that.
So no. Remember that if I remind you that I come to this as a clinician who was trying to...
physicians have been told not to speak to me?
I have no idea, sir. It's not right. Physicians have the right to speak to anybody.
Well, that's what I would think.
And there is a mechanism through surgeons have the Office of Surgery. Dr. Gunner has been a stellar leader in that they can work directly up through.
Well,
emergency medicine has the emergency medicine.
This stuff occurs. Okay, this is occurring now, today, yesterday.
Well,
this pattern of veteran or physicians within the VA being told not to speak to Congress, being told not to rock the boat because if you try to make it more productive, it's going to make somebody else look bad. I mean, these are direct quotes from physicians that work within your system.
So I also work with those physicians, and much of the improvement that physicians want to execute occurs at the local level, and we identify best practices at those levels, and we leverage our network capability to distribute them. There is no reason that physicians should not and cannot communicate freely. How can we have improvement if people don't feel that they can exercise?
Well, that's the situation as it exists today. I mean, I was at a VA physician meeting where there's perhaps 50 VA physicians, and the common theme of the discussion was that they were afraid to talk to me, and what can be done. I'm afraid to tell you what's going on at the VA, doctor, because everyone has told us that we will be punished. And that they were put through like onerous peer review situations that were obviously punitive. And so that they were afraid they wouldn't be able to practice outside the VA. Well, I'm just telling you what's occurring.
That's inexcusable, and I will
So can you pledge to me that if I speak to a VA physician and he complains to me that he was reprimanded, you will help me make sure that this whistleblower guy doesn't get punished?
Well, we don't tolerate punishment of whistleblowers. We absolutely do not.
Well, but I'm saying it's occurring today, Dr. Jesse. So if I have a physician who talks to me, because they were asking me, they were asking me yesterday, doctor, how can you assure me that if I tell you what's going on, that you can stop me from getting fired? And I had a little bit of trouble telling him that I could promise him that he couldn't get fired.
Well,
you understand what I'm saying?
Yes.
So what I'm asking you is that if somebody comes to me with that complaint, can you promise me they won't get fired?
I can, sir, I will promise you that they won't get fired for complaining to you. I can do that much. I can't speak to individual situations. All right, sorry.
But also understand that if we do find that somebody has directed people not to talk to members of Congress, it is a crime.
It's inexcusable. We don't accept that.
Okay.
I don't accept
it. It is criminal.
Yeah. I think the voice of the voice of the veteran who we serve, the voice of the line people working with veterans every day is crucial if we're going to improve this organization. We have to be listening.